Good morning. I'd like to talk to you today about understanding functional neurological disorder. It's a real neurological condition where the brain and the body have trouble sending and receiving signals correctly, causing a range of physical and cognitive symptoms without structural damage. What is functional neurological disorder? FND is a condition where the person experiences signal crossing between the brain and the body that doesn't work properly. They're real and distressing symptoms. It's not caused by any structural damage in the nervous system or the brain or the body. It relates to how the nervous system functions, particularly how the brain and body send and interpret signals. Common symptoms and common motor and sensory symptoms. Limb weakness or paralysis, like difficulty holding up hands, difficulty like holding a cup, difficulty eating with knife and fork, tremors or jerking movements, difficulty walking, abnormal tone or posture. There may be numbness or tingling in the hands and feet, vision problems, loss of sensation in the hands, for example, cognitive symptoms. So being able to function in day-to-day thinking, brain fog, thinking I can't think straight, things like that, memory issues, trouble remembering, concentration problems, being able to focus on a task, and anxiety and depression. As you can see, these symptoms are very real and very distressing for the person with FND. So, seizure-like episodes. FND can actually cause seizures in a person. They're very real, very distressing. They're just like a normal epileptic seizure. In FND, they are called dissociative seizures or absence seizures, and they need to be monitored and provided first aid for in the same way that you would treat a normal seizure. So, what causes FND? Childhood trauma or post-traumatic stress disorders from very horrific events, psychological factors, physical triggers like chronic pain, illness or injury, and cognitive factors, attention, beliefs, and expectations about the symptoms. First and foremostly, and very importantly, it's not all in the head. It's very real, it's very genuine, it's very complex, and it's a condition where the nervous system, the electrical wiring in the body is not working properly. Diagnosing FND. It's done by a specialist doctor called a neurologist. It has positive signs on examination of the patient. There's Hoover's sign and functional leg weakness, inconsistent movement patterns, exclusion of other neurological diseases, and it's a clear clinical picture, not just a diagnosis of exclusion. Treatment approaches for the person. As a support worker, you will need to be compassionate and understanding and understand about this being a very real condition for the person. It's a multifaceted approach to treatment. It's about helping the person understand what's going on, being very clear and direct in communication whilst being compassionate and patient, tolerant, and respecting that person, helping the person understand their condition. Physiotherapy, allied health treatment, psychology, helping the person understand what's going on for them, therapy, occupational therapy, support for daily life activities, and following up with the specialist doctor. Key takeaways: it's common and it's treatable, though it's often misunderstood by medical professionals and the public. Its symptoms are real and can be severe. It's debilitating as any other neurological condition. diagnosis requires specialist assessment, not just ruling out other illnesses, and compassionate care improves outcomes. Thank you for listening to my presentation today. I hope you were well informed and have a wonderful day.